I have the privilege to give the floor to Mrs. Alana Margaret Offices, who is the head of the Unit of Demographic Change and Healthy Aging of the World Health Organization. Alana, the floor is yours.
Thank you very much. So it's fantastic to be here. What a great day to celebrate. I really wanted to talk about a report that the UN produced. So UNDESA, WHO, UNFPA, and OHCHR. You've already heard about it. It was the first global report on ageism, which we released in 2021. And that report pulls together the best available evidence on the prevalence of ageism, on its determinants, on what its impact is, but also what works to address it. And we've already heard a little bit from Ambassador Mendez Escobar, but I think it's worth reiterating. How many people around the world are ageist against older people? 1 in 2, 50%. Half of the world's population. Just let that sink in. Half of us are ageist, yeah? And it has incredibly far-reaching impacts on our physical health, on our mental health, but also on our social well-being. And it intersects and exacerbates other forms of disadvantage, whether it's related to your sex, race, or disability. And it takes a really heavy economic toll on us as individuals, but also on our societies. But the overarching message is really optimistic. We can combat ageism. There are 3 things that work. Policy and law, it's important for this conversation, educational interventions, and intergenerational, bringing generations together. And I want to talk about policy and law because this is an important topic of conversation. The report says that it's an affordable strategy, yeah? That it works against ageism on any age groups, yeah? So it benefits all of us, yeah? That they're really important because they provide the framework, yeah? That we can evaluate proposals and activities against those human rights frameworks. And it also can be achieved. It can be achieved by either adopting new instruments at the local, regional, or national level, or modifying our existing instruments that permit age discrimination. But of course, national policies and laws or local policies and laws without enforcement mechanisms, so without teeth, are really quite ineffectual. So we need those enforcement mechanisms as well. And we've already heard about steady progress that's happening around national legal and policy provisions. But around the world, we know that the scope and coverage is really uneven. So we need to develop those protections, yeah, that also address the intersectional and intersectional and cumulative disadvantage that we know relates in terms of age and disability and gender. I think one of the things from WHO, so in terms of whether we need a legally binding instrument, I defer to member states. And as WHO, we take our leadership from member states. But if you ask me what the science says, what the evidence says about whether we need a legally binding instrument, the evidence is clear. We're a technical organization. The evidence says that one of the 3 most effective interventions for addressing ageism is policy and law. So from a technical perspective, we would very much support and be keen to support the development of a UN Convention on the Rights of Older Persons. Thank you, Ella.